duties that you have to perform in a home, at work, everywhere you go, even in social settings.
Yeah.
But I have to stress this. You're a man, you're out there and you're struggling. You don't need to depend on drugs to go back home and see your wife and say, this has been going on.
Yeah.
Why don't you change? You don't need a drug to enhance yourself to do that.
Yeah.
You need help. There is help that can be offered to you.
Yeah.
Just reach out. That is all I can tell the man that is struggling both at home and at work.
Yeah.
Yeah.
So, can we relate mental health, the, 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 the the too much mental health issues
Yeah.
that are coming up in men?
Mm.
Should we put 60% blame on the poverty levels? Do you think the poverty levels have contributed a lot of mental health issues?
In as much as financial strain and income instability is part of the social determinants of poor mental health in
Yeah.
men, there are other determinants.
Yeah.
Like we had talked earlier on, there are cultural norms,
Yeah.
there are social networks that men do not have. You end up isolating yourself
Yeah.
because you have no one to depend on.
Yeah.
There is workplace stress that is killing many of them.
Yeah.
Of course, like you've talked about finances, there is a lot of unemployment in our country.
Yeah.
Most men are in informal employment, which informal employment, is not stable.
Yeah.
So for any man who does not have any money in their pockets, they feel they are inadequate.
Yeah.
So that inadequacy causes a lot of low self-esteem. They feel they have no identity. They
Yeah.
feel they have no value, which leads them to being depressed,
Yeah.
which brings on anxiety, which leads them now to coping in funny ways, alcohol abuse, sexual immorality, substance uses. So poverty, yes, plays a big role in the men's mental health, but it is not the only thing that brings about the stresses, the challenges in their lives.
Wow. Yeah. When we connect back a bit and let's talk about the middle class.
Yeah.
Mental health in the middle class is actually becoming a bigger problem. When we talk about the middle class, this is where most people have gone to school. They are the most who are affected
Yeah.
with mental issues, mental health issues. The well-to-do family. When I talk about well-to-do family, okay, went to school, wife went to school, husband went to school, their child goes to a good school. That class of men suffers more of these challenges than the ordinary man who has no stress or less stress. What do you think is commonly causing all these, challenges in our day-to-day young men of 30, 35, 40, 45, actually below 60 years?
Yeah.
Yes.
That that's a very good question, Brian. And it is unfortunate. People who are doing well
Yes.
are the ones who are dying inside
Yeah.
because of the need to show off, because of the need to tell the world that I've reached there, because of the need of that instant gratification.
Yes.
Because they are the ones who can access these things.
Yes.
They are the ones that can access these good phones. They are the ones that can access the drugs. They are the ones that can access the money, the internet, everything. Go to these big mansions, big homes around.
Yes.
They are all hooked on the internet.
Yes.
And where do the problems come from? They come from home. You have bought for your child a phone. A 2-year-old, a 3-year-old has a phone.
5, 7, 10.
A teen has a phone. The mother has a phone. The father has a phone. The father is never in the house most times because they have the money. They are out there enjoying. The mother is on her phone. The teen is on her phone. The baby is on the phone.
Yeah.
What is going to happen in that home? The father will come back, will find there is no food.
Yeah.
Okay, he may not want the food, but there are things that are not organized, because if everyone is on their phones in a home, what will happen? Nothing will happen. They will all depend on the maid.
Yeah.
Or they will all order out. But how long is that going to take place? So the thing that happens in those homes is they have everything on their fingerprints.
Yeah.
So they forget about the outside world. Now, when you have everything on your fingerprints, when you have everything on your phone, comparison creeps in.
Yeah.
This one brought in a new phone. This one brought in a new car. I have to bring a new car. This one has bought a new dress. I have to bring a new dress. So when you don't get what you want at that moment, there will be an imbalance in your emotions. There will be an imbalance in your thinking.
Yeah.
You're not getting the time to share with your own family members. You're not getting the time to share with the children that are supposed to be molded by you, the parents. Now, there will be a lot of disobedience in a home.
Yeah.
There will be a lot of disrespect in a home. And those are the things that bring about a lot of challenges emotionally,
Yeah.
socially, and you find children in that home cannot relate with anyone in a community. So those are the things that will bring about a lot of challenges in that home. And at the end of the day, when those children grow up, how do you think they will be? There are the children right now who are depressed. There are the children right now who have a lot of anxiety.
Yeah.
In their schools, go
Yeah.
to school, the child is depressed. Go to school, the child has anxiety.
Yeah.
Go at home, the mother is stressed because they haven't bought them a new car.
Yeah.
You can imagine. The father is stressed because he
Yeah.
hasn't yet got money to buy the wife a new car. So those are the problems of those kinds of people. Not that I'm stereotyping,
Yeah. But that's what is happening, really.
but unfortunately, that is what is happening. And when we need to talk about things that are real, that is real.
Yeah.
And it is causing a lot of anxiety within homes. It is causing a lot of uncertainty within homes. And that is why you see the numbers are coming high.